Hello everybody, I hope this finds you well. I'm going to talk today a bit about our COVID numbers and also a visit that I made yesterday to University Hospital Monklands. I'll also mention the investment that has been announced by the Cabinet Secretary around social care in particular, which should help us with flow through hospitals as we go into the winter. And finally, I'm going to talk a bit about Black History Month and how we plan to mark that within NHS Lancashire. So if we start with the numbers, new case numbers yesterday were 414, that is slightly up. It has been down as low as 254 a few days ago, but it's kind of hovering around 300 really at the moment. Inpatients is trending down though, so 98 inpatients, that's the first time inpatients have been under 100 for several weeks, so that's very welcome news. And ICU numbers 7 yesterday. CPAP patients 7 as well, and outbreaks in care homes 8, and that is slightly down. We were up as high as 11 on the 1st of this month, so that is heading in the right direction as well. The booster campaign in terms of vaccination is now well underway, with 14,000 people having had their booster. So if you are an NHS member of staff, I would encourage you to book in for your booster, which if the timing is right, you can have at the same time as your flu jab, which also encourage you to get going into the winter. Secondly, I just wanted to say a bit about my visit to Monklands. I spent the day in University Hospital Monklands and was able to walk around some of the wards and meet some of the staff and just check really how people are feeling. And I think people are tired, I absolutely get that, and it has been a long haul, and we just talked about the supports that are available to staff. These are all signposted on the NHS Lancashire website. Also, there was some specific support that had been offered to some groups of staff in Monklands through spiritual care, which they were very grateful for, particularly in the renal unit in the early days of the pandemic. And it's maybe just to recognise how important that was for staff at the outbreak of the pandemic, and how helpful that input from spiritual care was. So maybe just to recognise that and say thanks to our spiritual care colleagues who provided that support. I also visited the receiving areas within the hospital and really impressed with the nurse-led pathways that have been put in place. Karen Cormack took me around and I was able to look at the minor injuries unit, which has been relocated, and also the new ambulatory care facility, and some fantastic nurse-led work going on there in Monklands, so just take my hat off to you. I will try and get out and about to our community services and also the other 2 hospitals over the next few weeks, so look forward to meeting with more staff, and just want to put on record again the fact that I just think staff are doing a fantastic job at the moment, and I do appreciate that it's difficult, and I took away some things that I think we can do to try and support you as we go into the winter. So we will absolutely look at how we can manage flow better, how we can look at our communications with GPs better in terms of patients coming into hospital and give advice, maybe in a slightly different way through our flow navigation centre. So we're taking all of that away and working through that with colleagues, whole system. You will have heard probably on the radio or seen in the press an announcement around a whole suite of measures which have been approved as of tea time yesterday, and CabSec talked through those measures on the radio this morning. A lot of resource being put into that, £240 million in total being put into a suite of measures really to support home care, care at home, interim placements to care home, and improved working by augmenting multidisciplinary teams in the community. So I'm hoping that all of that will enable us to keep people out of hospital and also to support people for an earlier safe discharge, because we are facing unprecedented pressures on our acute services as we go into winter, and equally our GPs are under huge pressure. So anything that we can do to stop those acute urgent presentations into our system needs to be done as soon as possible in advance of the winter period. So that was very welcome news from the Cabinet Secretary yesterday. I also just wanted to mention today that NHS Lancashire for the first time is marking Black History Month, and there is information about that on the Pulse website, and there is also an email contact address. So I would encourage you to join in. There are a number of ways that you can join in that. There are webinars, you can contribute tweets and signpost your thoughts on social media. I would encourage everybody to play into that, not just those from a black or minority ethnic background. We have launched our network within NHS Lancashire, and that is moving forward. And I'll cover this again later in October to share some personal thoughts around what we can all do to support that. Have a great weekend when it comes, and thank you again for everything you do every day for the patients within Lanarkshire.